How to cure and treat migraine. A recurrent throbbing headache, often in one side of the head, frequently accompanied by nausea, vomiting, and extreme sensitivity to light and sound. Migraines may include a stage called aura, which is marked by visual disturbances, flashes, splotches, zigzags, or shimmering colored lights surrounding a blind spot. Migraines can be an extremely debilitating and painful problem. The pain is caused by irritation to parts of the brain structure, like the dura, nerves, or covering of the brain called meninges. The three most common types of headaches are cluster, tension, and migraine. Cluster headaches are defined as brief, repetitive pain experienced on one side of the head. The pain is felt mainly behind the eye, which may even cause watery eyes and a runny nose. Tension headaches are constant pain felt on both sides of the head. Migraine headaches are pulsating pain for more than 4 hours on one side of the head, nausea, and inability to tolerate light or sound. You may even experience seeing halos or flashes of light, which are called auras. Get a good night's sleep. Changes in sleep patterns, changing work schedules, and jet lag can affect the quality of sleep cycles and trigger migraines. Try to maintain a regular sleep schedule. Get up and go to bed at the same time every day if possible. Keep the room dark. Be sure to rest in a dark room. Light sometimes aggravates migraine symptoms. Try not to sleep late. Though it might seem like a reward to relax and sleep in, giving yourself that letdown after stress is a common trigger because it affects your sleep patterns. Food and drink. Take note of what you eat. Certain foods and drinks triggers a migraine attack in about 10% of migraine sufferers. It can take from 30 minutes to 12 hours for a food to cause a reaction. If you get a migraine, think back to what you ate in that time frame and try eliminating some of those foods from your diet. Some examples of common triggers include chocolate and red wine. Spice it up. The hot ingredient in red pepper, capsaicin, is a terrific painkiller and may help those who have migraines feel better during an attack. You do not need to include red pepper in all your meals. You can buy cayenne pepper capsules in health food stores. Treatments. Trigger management. If you're prone to migraines, certain stimuli may bring them on. Track your headaches on a calendar to look for patterns and potential catalysts such as the following. Dropping estrogen levels. Before menstruating, women have a steep decline in estrogen that appears to spark migraines, says Andrew Michael Blumenfeld, MD, director of the Headache Center of Southern California. Low-dose estrogen contraceptives may help. Alcohol. If you get a hangover after one drink, you may actually be experiencing a migraine. Avoid alcohol that gives you a headache within 8 hours of consumption. Missed meals. Fluctuations in blood sugar can cause a cascade of escalating pain that sets up your migraine response, so don't go longer than 3 hours without food. Include a lean protein whenever you eat to help keep glucose levels steady, Dr. Broner says. Caffeine. If you regularly consume large amounts of caffeine, you set yourself up for withdrawal headaches, which can stimulate your brain's migraine center and turn into migraines. Limit intake to 200 mg a day, that's roughly 1 8-ounce cup of coffee. Sleep disruptions. A 2010 study found that sleep-deprived rats experienced changes in key migraine-related proteins. Play it safe by being consistent about when you go to bed and get up. Ice packs. Always opt for cold rather than heat to stop migraine pain. Ice is an anti-inflammatory, says Caroline Bernstein, MD, Clinical Director of Harvard Medical Faculty Physicians Comprehensive Headache Center at Beth Israel Deaconess Medical Center. Supplements. In a recent study, patients who took 400 mg of riboflavin, vitamin B2, daily experienced significantly fewer migraines after 3 months. CoQ10, another supplement, also proved effective in preventing migraines in a clinical study. Relaxation techniques. Massage can ease neck and shoulder spasms, while Tai Chi increases body awareness, making it easier to detect and treat an oncoming headache. Yoga that focuses on mindfulness, such as hatha and restorative yoga, may also help. Get started with these 10 yoga poses for emotional health. Herbs. New recommendations from the American Academy of Neurology confirm that the herb butterbur can prevent migraines, possibly because it supports healthy blood flow to the brain. Dry leaf capsules of feverfew may also reduce the frequency of migraines, though the clinical evidence is still inconclusive. Acupuncture. Several studies have found that it provides some of the same long-term results as drugs but without side effects. While this efficacy may be partly caused by the placebo effect, the treatment can still provide real relief. Want more info? See 6 science-based benefits of acupuncture. Triptans, introduced in 1991, these prescription drugs, which include Xert, Rolpax, and Imitrex, are formulated to stop migraines. They affect almost every migraine-causing mechanism, but they may sometimes cause rebound headaches. Beta blockers/antihypertensives, intended to treat high blood pressure, angina, and fast heartbeats, these drugs, which include propranolol, metoprolol, and timolol, are also used to prevent migraines because they are thought to affect relevant blood vessels. They have few side effects but can sometimes result in dangerous heart rate drops. Anti-seizure medications. For some migraine sufferers, prescription drugs to stop seizures, such as topiramate and valproic acid, also reduce migraine frequency by at least 50%, possibly because they inhibit some neurotransmitters. But they can cause adverse side effects, such as confusion and drowsiness. Antidepressants, tricyclics and SSRIs have been shown to be effective in treating migraines. Researchers say this is because some migraine attacks are characterized by abnormal levels of serotonin, which the drugs work to balance. But they're not usually advised if you don't need treatment for depression. Botox, approved by the FDA in 2010, Botox injections to treat chronic migraines are clinically proven preventive. A treatment involves about 31 shots, given about every 12 weeks. Side effects are rare. Keep calm. Evidence suggests that stress, anxiety, and/or anger cause the brain to become overexcitable and may place you at risk for experiencing headaches. Meditate. Deep breathing and other forms of relaxation can help alleviate stress and reduce headache frequency. Take a bath with the lights off. Soak yourself face down, don't forget to come up for air, and just try to relax your body. Take over-the-counter medications. Non-steroidal anti-inflammatory drugs like naproxen, Aleve, or acetaminophen, Tylenol, may often be effective in treating low-level migraines. Use acupressure to momentarily relieve pain. Tap 3 times on your temple, your shoulder and then the inside of your wrist. Repeat. Try mint therapy. Make mint tea. Breathe in the vapors while it steeps, then drink the tea. Even the mint tea bags can be used as a tension reliever. Chill or freeze the tea bags for a short while to cool them down, then place them over your closed eyes while you relax.